A patient walks out of a clinic with a clean bill of health. Two specialist radiologists have reviewed her screening mammogram and cleared her. 6 months later, she receives a stage 3 cancer diagnosis. This is an interval cancer, a tumor that appears between routine screenings. When researchers reviewed that original cleared scan using an artificial intelligence system, the software flagged the microscopic beginnings of the tumor instantly. The evidence was there, but it remained invisible to human experts. To understand why these anomalies are missed, we have to look at the volume of data radiologists now process. The exponential growth of medical imaging has forced specialists to review hundreds of complex scans every single day. Staring at grayscale monitors for 12 hours induces severe visual fatigue. When combined with dense breast tissue, which appears solid white on a mammogram, early-stage tumors are physically masked by a form of biological camouflage. The result is a system defined by chronic physician burnout and unavoidable, life-threatening missed diagnoses. Even with years of training, the human eye has physical limits. Human biology has reached its capacity for analyzing modern radiological data. For these patients, a non-human solution has become a clinical necessity. Artificial intelligence foundation models address this by shifting the diagnostic process from perception to calculation. These systems are trained on hundreds of thousands of historical images to recognize the specific mathematical signatures of disease. Unlike a human who scans for recognizable shapes, an AI processes native high-resolution pixels. It treats every image as raw mathematical data, identifying patterns that have no visual equivalent to the human brain. This diagram shows the mammo-FM architecture, using parallel image encoders to process 4 mammographic views simultaneously. It correlates these visual anomalies with structured data, utilizing a findings checker to learn exactly what clinical threats look like at the pixel level. The software registers complex geometric arrangements and density variations that are physically impossible for the human eye to capture. By removing the variable of human fatigue, AI shifts the diagnostic baseline from flawed perception to computational certainty. To validate these gains, researchers pitted these algorithms against the world's best doctors in massive, real-world clinical trials. In a landmark NHS study, a Google AI reviewed the mammograms of 125,000 women. The system reduced false positives across the board and successfully identified 25% of the interval cancers that human doctors had previously cleared. Following this, the Swedish MASAI trial showed that AI-assisted workflows made overall cancer detection rates skyrocket by 29%. Beyond detection gains, the MASAI trial revealed a secondary impact of the radiologist's daily workflow. Integrating AI didn't just find more cancer, it reduced the screen reading workload for radiologists by a staggering 44%. This automation saves roughly 1 hour of reading time per day, stripping away the repetitive, high-volume tasks that cause cognitive fatigue. These trials confirm that AI is capable of solving the 2 biggest crises in modern radiology: the tragedy of missed cancers and the epidemic of doctor burnout. Achieving superhuman detection is only the starting point. The next phase of this technology moves from identifying existing disease to anticipating it. The FDA recently authorized Clarity Breast, a platform capable of analyzing mammograms that appear entirely clear and healthy to a human expert. This moves the technology from diagnosis to prognosis. The AI scans a pristine cellular landscape for the invisible spatial patterns that precede tumor formation. By analyzing these tissue patterns, the model generates a 5-year risk assessment. It can predict where a tumor is likely to form years before it is physically present. This pixel-level precision is far more accurate than traditional markers, such as breast density or family history, which offer only modest risk stratification. While some fear this technology will displace radiologists, its actual role is to eliminate their most grueling, repetitive labor. By offloading burden of the invisible to a machine, doctors are empowered to do what they do best: focus entirely on complex patient cases and saving lives.